Welcome to The Better Life with Dr. Mary Ann Pinkston. Join Dr. Pinkston today as she teaches you how an integrative approach to health, combining holistic and contemporary medical information, can lead you to the better life. And now, here's your host, Dr. Mary Ann Pinkston.
Hello there, everybody, and welcome to The Better Life with Dr. Pinkston. I am Dr. Mary Ann Pinkston, and I am here with my friends from Pinnacle Clinical Research, who has been a fantastic sponsor and supporter of me all year, with good reason, because liver disease is widespread and very common in South Texas as well as the United States now, with all of our processed foods and weight gain and things like that. And so I am here today very honored to have my guest, Dr. Rudraraja, here with me, who's the new medical director of Pinnacle, and so glad to have you on board, and thank you for being on with me.
Thank you.
Welcome
No,
in.
it's a pleasure. So I'm glad to be on board because from Pinnacle as well as me, we share similar values in promoting education out there and more awareness about fatty liver disease. And also, I personally believe that food is medicine.
Yes.
So, which is what your viewers are interested in.
Absolutely.
So we have those common interests. So I'm glad to be on this podcast
Thank
today.
you. You are a very passionate clinician and researcher and have done some great work with Pinnacle. And so now you have risen to medical director and in control of it all. Good luck. That sounds like a big job.
It is a big job, and we are expanding. So just this year, we've opened a site. Right now, or earlier this year, we only had San Antonio and Austin as our two locations for clinical trials. Now we have opened a site in Georgetown, Texas. So, and maybe not this year, but first quarter of next year, we'll have a site in South San Antonio on South Cross, somewhere
South Cross
there.
Right? Oh, that's fantastic! Congratulations!
So excited to have more locations to serve more population, especially like you said, South Texas, San Antonio. We are the mecca for all kinds of liver disease, including fatty liver, which is what we specialize in. But we also specialize in all liver diseases. So
which we
happy to serve wider population.
Absolutely, and we will be touching on that. I want to really focus on liver disease, especially the generalized, disease front of it. But tell me what Pinnacle does. What are you say clinical research? But people imagine themselves, I think, being kind of a lab rat running a maze somewhere, clinical research. I know sometimes I'll tell my patients that, and I can see kind of a face where they're not sure, but you guys are not experimenting on people. You guys are doing some wonderful work, truly well designed and well studied work. So explain what Pinnacle does.
So Pinnacle does all kinds of clinical trials. As I said, main focus is on fatty liver.
Sure.
Though patients may feel like, I'm being sent to be a guinea pig or a lab rat, that in a small sense may be true in their mind, but they also have to know that all these great medicines that came in because someone had to volunteer to do these studies.
Exactly.
And it is important in fatty liver especially to do clinical trials, because outside of clinical trials, there is no approved medicine to treat fatty liver / NASH.
Right.
There is treatment which is losing weight, eating healthy, right? If everyone is able to do it. So there's one study where they did diet and lifestyle, like exercising, eating healthy, with a goal to lose weight specifically. And with 1 year of doing the lifestyle changes, about 2/3 of them had no change in their weight.
Oh, my goodness. Wow.
And about 20% gained weight, which is the worst of what should be happening, right?
Sure. Yes.
And only about 6 to 7% really had 10% or more body weight loss, which is exactly what is needed to treat fatty liver and NASH. It not only improves the fat, it also improves the scar tissue if they lose that 10% and maintain it that way.
Right.
So when you look at it, so if only 6 to 7% in a structured environment where at least someone seeing them and trying to motivate them are able to achieve that target, when you think of yourself as a guinea pig, we don't think of it as that way because we are trying to help the other 90+% that will not be able to achieve that goal. So this is an adjunct to you doing your diet and your exercise and everything. If you're successful, perfectly fine. Truly, for clinical trials, if you lost too much weight in a short period of time by doing the right things, you will not be eligible.
Isn't that crazy?
So I know, right? Because, and the reason for that is if you lost that weight, you are treating your fatty liver, and we don't want to give that credit to that placebo group, right? Where it makes you feel like, oh, that sugar pill, minus the sugar, of course.
Right.
It made them lose so much weight, or it made them improve their fatty liver, and then it makes the drug look bad, right? So it's all those confounding variables that we talk about in medical literature.
Absolutely.
So avoiding that, which is why, as I said, if they really are able to do with diet and exercise,
there's your cure, right?
Right.
There it is.
You are the minority of people that can do it.
Yes.
For the rest of them, it is giving the extra support needed to help prevent their liver from progressing.
Exactly.
And if they're worried about, oh, I don't know what that medicine does, there are a lot of medicines that are safer. So like we have protein supplement studies, or we have fish oil, kind of altered fish oil supplement studies. So if you want to stay in the more natural route, we also have those options. We also have options where, these medicines, but for viewers, weight loss medicines like Ozempic and things like that, we call them the GLP-1s.
Yes.
So we have medicines like that. So an improved formulation of those, newer GLP-1s. So these are medicines that truly are not first in the market.
Sure.
So there's others like that, or they're established for other indications and are being used for this.
Right.
And in clinical practice, most patients have trouble getting those medicines because of copays or insurance not allowing it. So it just gives them an avenue to get medications that they may not be able to get otherwise in clinical practice, and they're not approved for this indication.
Right. Very important, because that is what, we're dealing with people trying to get semaglutide or all these medications, and the insurance, they're $1,000 a month if you don't have insurance, but insurance will not pay for it. If you don't have diabetes, we are trying to prevent you from getting diabetes. It makes sense to use the medication, but they won't pay for it.
I know. It's unfortunate that prevention is not covered for the most part.
We're talking about things making sense. So when it comes to, sorry guys, when it comes to insurances, that's not always the case. But so you're talking about the 10% weight loss. So if you're 200 pounds, that is 20
would be 20 pounds
that's
of weight loss.
That's really not a lot to ask.
It is not.
People.
And again, I wouldn't say 10% will do it in everyone, and 80 to 90% of the people that will do the trick. There's never 100%,
no,
right?
Of course. No guarantees ever. But that is still, good odds.
And the important thing for people to know is if they think, oh, it's just fatty liver, I have fat here, I have fat in the rest of my body, it's what's the big deal about it, right?
Yes.
But fatty liver causes cirrhosis.
Yes.
Everyone will say, it's like, I don't drink alcohol, so I don't get liver disease, right? That's how we think. It's the misconception that is out there.
Absolutely.
But fatty liver is the number one cause for liver transplant in women for the past 6-7 years. It's the number one cause for liver and kidney transplant. Not saying fatty liver is damaging that kidney, it's the underlying metabolic risk factors. So the diabetes, everything. So it's leading to both the liver and kidney being failed. So it's the number one cause for liver kidney transplant in both men and women. And in men, it's only second to alcohol.
Wow.
So very out there that is underdiagnosed
Yes.
and under-recognized and not given the attention that it deserves.
Absolutely. It does
So-
not get the attention it deserves. So you guys are doing that.
Yes.
I watch your social media. You've got some great information. So please go back and look at, the Instagram and all. Great information you guys do. A free FibroScan
Yes.
for patients. And so FibroScan, explain that briefly
Yes.
for, I know you want to talk
Great
about more. but
question.
yeah,
Yes.
but let's discuss that.
Because the main thing that we offer as kind of community service is a FibroScan, which is an ultrasound, not your regular ultrasound
Sure.
that you would get in a radiology practice. This is an ultrasound where it sends some sound waves in, and depending on how fast it's coming back, it tells you how stiff that liver is.
Yes.
So as you have liver damage from whatever the reason is, alcohol, fatty liver, hepatitis C, hepatitis B, other causes of liver diseases,
Sure.
as your liver gets hurt, it deposits scar tissue. Just like if you have an injury, you have scar tissue. Same thing is happening inside the liver from the fatty liver, alcohol, whatever it is. And as you get more and more scar tissue, the liver is more and more stiff.
Yes.
So depending on the stiffness, you'll be able to tell how much scar tissue there is in the liver.
Right.
So the FibroScan gives you two pieces of information. One is how much fat there is in the liver. You could say, oh, the ultrasound will tell me that. The ultrasound tells you that when you have 20, 30% or more fat in the liver.
Yes.
This tells you when there's even more than 5% of fat in the liver, which is the definition for fatty liver is more than 5% fat in the liver. So it detects it at early stages. And the second thing it does is the scar tissue, which you will not be getting that with an ultrasound.
Gotcha.
So it gives you more information
About
in
damage, actually.
how much, the damage, how much damage has happened to the liver so far throughout the years of whatever they have done. And based on that, you can say, how close am I to trouble?
Right.
Trouble is cirrhosis and complications,
Exactly.
right?
And
then it just tells you, it's like, okay, how serious do I need to be to fix myself? So if you don't want to see me in my other clinic, not Pinnacle, I'm a transplant physician at Methodist, and transplants my bread and butter for all these years. So if you don't want to see me in that other clinic, so you need to figure out where you are so you can prevent going to that stage to not see me in the other clinic for a transplant.
Absolutely. No offense, but I do not want to see you. Right? So, the FibroScan is very easy. So I went and had it done, and it took minutes. I thought I'd be there for a long time, and it took minutes. I was in and out, first of all, so it's very convenient, but it painless. There was no needles, no pain whatsoever. And then it was lovely because you actually came in and spoke with me afterwards, result wise, and also we had a nice discussion. So I knew what to do next. So it wasn't just, kick me out and what do I do or what was my result. I knew immediately, which was wonderful. And staff was all great. It was easy parking outside. I mean, the whole thing was just quick and fast.
Yes. We want to make it easy for people so they're willing to come.
Absolutely.
And the other thing is also bring their family members in, right? If you have fatty liver, the chances are your other family members have fatty liver. There's the hereditary predisposition to it. Hispanics are more prone to it. If you have diabetes or if your family members have diabetes, then they're at risk for it. If they have high cholesterol, if they're obese with a BMI of over 30, they're at risk for it. So we want you to have the best experience, and we also want you to bring more family members and friends at risk, right? So bring them in so they also know where they stand with their liver. And anyone coming on site for a FibroScan in any of our locations, there'll always be either an MD or an advanced practitioner going over the results, kind of getting a brief history about everything. So we can tell them where they stand with their liver disease and what can they do for the future to prevent from progression of the disease.
Absolutely, and that worked beautifully like that.
Yes.
It was very quick, and so in order to get scheduled for that, I've got information in order for people to call and get scheduled for that. So you guys in San Antonio and Austin.
Yes.
So there are people in Austin who do hear this, and so San Antonio is 210-529-7978. In Austin, 512-601-5788, and this is all on my website. So drpbetterlife.com. You can go and find this is podcasted out to all the platforms plus YouTube, and then it's on San Antonio radio Sundays at 4 p.m. on AM 930. But you can go to pinnacleresearch.com, and again, all this information is going to be on that website for drpbetterlife.com. And so I told you this goes fast. We're coming up on a quick break, and I want to talk about on the other side more.
So one other quick thing
please.
I do want to mention is they can also sign up for a FibroScan on our website. So they don't even have to call the numbers. If they give their information, we will give them a call and get them scheduled.
So a contact form on pinnacleresearch.com. So yeah, and when we come back, I want to talk more about just general liver disease and some things that go on besides fatty liver, because fatty liver, although most common, I think it's 1 in 3 adults in South Texas, right, as the stats.
Yes.
And so if we if we can focus on some of those things other than fatty liver, even though that is the most common, that'd be great. But I know that you guys also with the FibroScan, is it something that it's a screening tool, right?
Yes.
Not a diagnostic tool.
It is not.
And there's a difference between the two, and we can talk a little bit more about that on the other side of the break. But as a screening tool, it's just to give you some information, so then we can take things, look a little bit further. And find out exactly what is going on.
If we see someone that is probably going to be in trouble, what that indicates is they need more testing in the terms of an MRI or a liver biopsy. And if they are willing to participate in clinical trials, that could be done at no charge to them.
Wonderful.
As part of clinical trials. If they're not interested, that is okay too, and they can get it done through their insurance with their medical provider. So either their primary care or a GI specialist or someone that they could see.
Okay, well, very good. So pinnacleresearch.com. You can also go to drpbetterlife.com. Let's take a quick break. We'll come back and talk about liver disease. Thank you.
Fatty liver is linked to 2 different situations, alcohol and diabetes or obesity. In both cases, patients can have no symptoms. In the United States, and in particular, Texas, the most common cause of liver disease in general is non-alcoholic fatty liver. Again, associated with overweight, obesity, and or diabetes. Additional risk factors include high cholesterol, high blood pressure, Hispanic ethnicity, and postmenopausal status. At Pinnacle Clinical Research, we offer a quick, non-invasive ultrasound-based screening assessment called FibroScan. This test is done at no cost to you, and we do not take insurance. The test will measure the fat and stiffness in your liver and stage your risk and development of fatty liver disease. You will meet with a provider immediately following your scan to go over your results. If you're interested in getting more information on your liver health, please call 210-982-0320 and schedule your FibroScan today. We are conveniently located in the Medical Center at 5109 Medical Drive.
Welcome back, everybody. I am here with Dr. Rudraraja. See, I told you I was going to do that. So Rudraraja, and medical director for Pinnacle Clinical Research. And we are discussing fatty liver disease, but we also want to talk about generalized liver disease when it comes to alcohol use, because you can't imagine how a little bit goes a long way on the liver with this, but also about supplements, too. I know those are 2 things that people are very, especially the holidays, commonly use. So explain liver disease and alcohol and supplements.
Okay, so alcohol, everyone knows alcohol can cause liver disease and cirrhosis, but there's not as much knowledge as to how much alcohol really causes trouble.
Yeah.
So there are multiple factors involved with this: your weight, your family history, and obesity, other liver diseases. But in general, the safer amount of alcohol for a woman is only 1 drink a day.
Okay.
And for men, it's only 2 drinks a day.
Sure.
And there's a lot of people that drink way more than this.
Absolutely.
And I see this all the time. They say, it's like, but my friends drink more than me. Why me? Right? So many factors that come into play, genetics
Absolutely.
and other things. So alcohol is the number 1 cause for liver transplant in men. The unfortunate thing that we have been seeing, I was on call this weekend, I saw a couple of people in their 20s that have alcohol-induced liver failure, jaundice, glowing in the dark, right?
Wow.
Alcoholic hepatitis.
Okay.
If they consistently drink a lot of alcohol,
Sure.
if they do binge drinking,
Yes.
they can have not just cirrhosis. Cirrhosis
Sure.
can happen at a later time, but that acute alcohol can damage their liver. And some of them will recover. The people that don't recover will need a transplant. I see a lot of younger population dying with alcoholic hepatitis.
Gotcha.
And COVID hasn't helped. People have picked up on alcohol. So my patient population in my transplant clinic is getting younger and younger.
And it's preventable.
It is preventable.
So 1 a day for
right?
women, 2 a day for men. And that
Right.
doesn't mean you can do all the 1 a days and punch it up in the weekend.
Binge it,
but I'm a
right?
drink during the week. I just do it on the weekend. So yeah, you can't have all 7 or 14 on the weekend. So.
Right. And that's assuming you don't have fatty liver disease
Already,
or
right?
hep C
Sure.
or anything else. If you have underlying liver damage, even that could be
Cut that in
high.
half maybe, so, right?
Yes.
So, well, what about supplements? So we talked about that beforehand.
Right. Supplements, they're great.
Yeah.
But the problem with them is they are not regulated.
Yes.
One of the common supplement we see, and we have New Year's coming up, everyone will have resolutions to
Yes.
lose weight, get healthy, get on those supplements, burn some fat, right? Green tea extract.
Yes.
I do see liver failure from green tea extract couple of times a year that we have to transplant them because their liver is so damaged.
Okay.
And some of it is what's in there, like green tea extract can cause it. Some of it is what is not listed in the supplement stuff. So since it's an unregulated,
right? Yeah,
yes, all
fillers
these
are-
fillers, or sometimes they say they don't have stuff and it has stuff. So
Absolutely.
it's just not using a reputable supplement
Absolutely.
is what it is. I've seen patients where they come, they take stuff, and a couple of times I've seen it says one is a liver protectant, right? They're taking that and they still had liver failure and needed a transplant.
Now this is something I really harp on and highlight very much because there are, again, it's not regulated, so they
Yes.
can put anything in there and not advertise it. Does not have to be studied, and so it matters what company you buy it from and source. So if you can get the same company brand on Amazon from a third party, does not mean you're getting. Anybody can seal a bottle. And they can take them out, put anything they want to in a bottle, and reseal it and sell it independently. So it really does matter. Speak to your practitioner. Find out where to get a good, supplement from a resource that is reputable, and make sure that you are following the directions on the label or through your, practitioner. Not because you studied on Google. I am so sorry. I do that all the time. You are
and more is not better.
And more is not better, because something like green tea extract is very popular for immune system through COVID and all, and the flu season, but it can be overdone. Anything. I just tell people all the time, things that are good for you, but too little of something and too much of something does not, incur that it is really good for you.
Right.
So I'm so glad you brought that up. Thank you.
I know. And again, it's like all these people, they're trying to help themselves, be involved and take care of themselves. And it's sad to see someone like that ending up in trouble because of using the wrong product.
Yeah. Well, and people don't realize that, liver damage and liver disease is not something that you can just look. I can't look at you, you don't have it, but look at you, for instance, and say, you have liver disease, you don't. I mean, you cannot tell.
By the time you tell, it is advanced.
Yeah, exactly, with the jaundice or things like that. So, yes, so it's something that you have to investigate. That's why we do the FibroScan and other testing, but take a good history, talk to our patients about their meds and supplements and their habits. And so, this is something we do have to investigate and follow very closely in order to make sure we catch that population that's at risk. Because once you have liver disease, then you add the supplements or alcohol on top, Tylenol, things like that. Then, imagine doing, Tylenol.
I'm glad you brought up Tylenol.
Yes, and alcohol. So I had a hangover, I drank last night, and now I'm taking my Tylenol for my hangover.
Right.
Yeah.
And Tylenol itself, people unknowingly get Tylenol from multiple sources.
Absolutely.
It's in their flu medicine, their pain medicine, their narcotic medicines, everything. So it just adds up. So anytime people are using Tylenol, they need to add all sources that it is in there. Stay at less than 4 grams a day if they have no liver disease and if they are not drinking alcohol.
Right.
So if you're staying in that range, it's unlikely you would have liver damage from the Tylenol. And if you have liver disease, then less than 2 grams a day.
Okay, I usually say 3, so I'll tidy that up.
2.
So
Cirrhosis
2,
and stuff, it's 2.
Yeah, right. Okay,
2
gotcha.
grams a day.
Wow. Well, I am going to, I told you that would go fast too. So I'm going to quickly give you the information where you can find both Pinnacle. So Pinnacle Clinical Research is who we're highlighting today. And again, thank you guys. You've been a great sponsor for me all year. I really appreciate it. So pinnacleresearch.com, you can sign up and get your free FibroScan. You can also find all their information on drpbetterlife.com. Guys, I thank all of you, Tamara, everybody, Dr. Harrison, Dr. Rudraraja. I appreciate you being on today.
Thank you for having us on.
Absolutely. So
being able to educate more people about liver disease.
That's what it's all about. So everybody, have a fantastic
Thank
week.
You, Dr. Pinkston.
Goodbye.
Happy holidays, everyone.